It is really hard to go through cancer alone.
It's a very anxiety-provoking moment, and to try to keep one's wits about oneself is challenging, to say the least. So one piece of advice I would give to anyone with a diagnosis of cancer is to pair up with a friend and a family member who can accompany you when you go to visit your physician.
The reality is that people get better care when it's a team that is participating with the patient in the care, as well as a team that's delivering the care. You know, sometimes it's a challenge because sometimes there's lots of questions. Sometimes the questions make sense, sometimes they don't. And what the caregiver has to do is, the best of their ability, is to find a way to be a caregiver without trying to influence or change, because that's associated with a lot of angst. And oftentimes the caregiver has to have a good cry. I wouldn't do this. I wish that it wasn't this way. I wish that they wouldn't do it this way. But what you don't want to do is you don't want to influence the decision to make the person that has cancer take a course that they don't feel comfortable and settled in. And so the caregiver has to walk a fine line. They have to walk the fine line in support of, while still listening about how they might manage it. And the caregiver is often fraught with enormous anxiety that is different than the anxiety of the cancer patient. The cancer patient is fighting the battle. The patient is in the fight. The caregiver may be thinking about the children, the what ifs. What's going to happen if she or he is not here? How am I going to live? But you don't ever break the patient-doctor bond. So if the caregiver wants information that is not in the best interest of the patient has to feel like they're in control of that situation. So those are the delicate paths that you get experience for that they never train you in medical school, and science never trains you about. But if you want to be a deliverer of high-quality cancer care, you become sensitive to your own process and your ability to deliver something that people, whether it's the patient or their family, can handle. People need support. And I think that's true. They just need to know, they need to be touched. They need to be listened to. They need a separate pair of ears that can listen to the doctors talking. Decide based upon the information how you might do it, but how best to support your significant other, and then be there for them even if their choice was not necessarily what you think you would have chosen. Because none of us really know what we would choose unless it was in our face.